You feel like you want to crack the code on your pet's health,
Yeah.
without digging through dense medical journals for hours.
Yeah, absolutely.
Well, that's what we try to do here. Today, we're diving deep into something you might spot on a vet report. Hyperchloremia in dogs and cats.
Mm-hmm.
Basically, it just means there's a higher than normal level of chloride in their blood.
Mm-hmm.
The numbers are generally over 122 MEQL for dogs and over 129 for cats.
Exactly. And think of this as like your quick guide to getting a handle on hyperchloremia. We're going to look at what it is, what might cause it, what signs you might see in your pets, and really why it all matters.
Yeah.
There are actually some surprising connections, with how these electrolytes work.
Sounds good. Okay, so chloride. I mean, we know it's in the blood, but what's its actual job? What does it do in our pets?
Right. So chloride at its core, it's the most abundant negatively charged ion that's an anion in the fluid outside of cells. It's really key for fluid balance, nerve function, that sort of thing. And what's really interesting is its close relationship with sodium. Very often, if chloride is high, sodium is high too. That condition is called hypernatremia.
Ah, so they're kind of buddies, like they show up together often?
Pretty much, yeah. It's common. Both levels can go up when a pet loses more water than salt, sodium and chloride, or much less commonly, maybe if they somehow ingest a whole lot of salt.
Okay.
There's another side to it. Chloride also has this inverse relationship with bicarbonate, another key electrolyte.
Inverse. So like one goes up, the other goes down.
Exactly. If the body loses too much bicarbonate, maybe through the GI tract, like diarrhea, or through the kidneys, it tends to hold on to more chloride to keep the electrical balance right.
Huh. So high chloride isn't always just too much chloride. It might be the body compensating for losing something else. Interesting. Okay, let's play detective then. What are the main culprits behind high chloride?
Yeah, we can sort of group the causes. Makes it a bit easier. First, you have situations where there's genuinely just too much chloride in the whole body system. Now, this is pretty rare from just eating something salty, but it can happen, for instance, if a pet gets a large amount of IV saline, sodium chloride solution, maybe during emergency resuscitation.
Right, so necessary medical treatment could have this side effect sometimes. What else?
Then you've got cases where the total chloride might be normal, but the body's water level has dropped significantly.
Dehydration, basically.
Exactly. Think about a pet not drinking enough or losing way too much water in their urine. That happens in conditions like diabetes insipidus, where the kidneys can't conserve water properly.
Wow.
Even just heavy panting, if it's excessive, can lead to enough water loss to concentrate the chloride that's left.
It's kind of wild that something as simple as not getting enough water can throw off blood chemistry like that.
Yeah.
Okay, what about, you mentioned a situation where total body chloride might actually be low. How does that cause high chloride in the blood test? That seems backwards.
Yeah, this is where it gets a bit counterintuitive, almost like a puzzle. Sometimes a pet loses fluid that's less concentrated in electrolytes than their blood. We call that hypotonic fluid loss.
Okay.
And paradoxically, this can lead to hyperchloremia. You might see this with excessive urination in, say, diabetes mellitus or something called osmotic diuresis, where substances in the urine pull extra water out.
Pull water out. Got it.
Or even after a urinary blockage is cleared and there's a sudden massive amount of urination, the body loses more water relative to chloride, so the chloride remaining in the blood becomes more concentrated.
Okay, that makes sense now. Losing more water than chloride makes the concentration go up. Fascinating. And you also mentioned hyperchloremic metabolic acidosis. That sounds different, more like an acid problem.
It is, and it's a really important category. This is an imbalance where you have too much acid in the body along with that high chloride. Kidney problems are often involved here.
Like what kind of kidney problems?
Yeah. Well, for instance, with renal tubular acidosis, the kidneys might either lose too much bicarbonate, that base we talked about, or they might not be excreting enough acid properly. Either way, the body compensates by retaining more chloride.
I see.
And severe diarrhea is another big one. Losing a lot of bicarbonate-rich fluid from the gut prompts the kidneys to hang on to chloride to maintain that balance.
Wow. Okay, so it's really a web of potential causes.
Right.
Now, for pet owners listening, what might they actually see? What are the signs if their dog or cat have high chloride, the red flags?
Well, it's important to remember the signs often link back to the high sodium that frequently accompanies it, or just the underlying illness causing the whole problem.
Right.
But key things to watch for: definitely increased thirst, polydipsia. You might notice your pet is just constantly at the water bowl.
Okay.
Neurologically, you could see things like disorientation, confusion, and more severe cases, especially if the changes happen quickly, you might even see coma or seizures.
Whoa.
The severity of those neurosigns often tracks with how high the sodium got and how fast it got there.
Definitely serious signs. So if a vet runs tests and finds high chloride, what else are they thinking? What's on their differential diagnosis list?
Good question. Diagnosis involves ruling things out.
Yeah.
Hyperchloremia rarely happens alone, right? So the vet's thinking about other causes of what's called normal anion gap metabolic acidosis. That's the type of acidosis where chloride goes up to balance the lost bicarbonate.
Like the kidney and gut issues we discussed.
Exactly. They'll also consider diabetes insipidus, different types of dehydration, especially hypertonic dehydration where more water than salt is lost, and severe diabetes mellitus complications like DKA or HONK syndrome,
DKA and HONK.
diabetic ketoacidosis, and hyperosmolar non-ketotic syndrome, both diabetic emergencies. And yes, in super rare cases, they might think about actual salt poisoning, though that's uncommon.
Right. So lots to consider. It's like putting puzzle pieces together from the symptoms and the lab work. Speaking of labs, what specific results might point towards these different causes?
Well, obviously, the high chloride level itself is the starting point, often with high sodium, too. But other tests give clues. For diabetes insipidus, you might see really dilute urine, low urine-specific gravity.
Okay.
For the diabetic emergencies, you'll see very high blood glucose. And for things like renal tubular acidosis, looking at blood gases, the measure of oxygen, CO2, and pH in the blood and urine pH can be really diagnostic.
It's amazing how much detail you can get from those tests.
Yeah.
What about medications? Can drugs our pets take affect chloride levels?
Oh, absolutely. Definitely. Some drugs can interfere with the kidney's ability to concentrate urine. This leads to losing more water than sodium, which can bump up both sodium and chloride.
Like which ones?
Examples include lithium, dimethylcycline, amphotericin B, that's an antifungal. And then there are other drugs that can more directly increase chloride itself, like acetazolamide, ammonium chloride, certain hormones like androgens, and even cholestyramine.
That's quite a few possibilities. Are there other, weird things that could mess up the chloride test results themselves? Give a false reading.
Yes. This is a really important point, actually. A crucial heads up, especially if you have a pet with epilepsy.
Okay.
If a pet is being treated with potassium bromide for seizures, the bromide ions can sometimes be mistaken for chloride ions by certain lab test methods, leading to a falsely high chloride reading.
No kidding. So the test thinks bromide is chloride.
Essentially, yes, depending on the specific test used. Also, really high levels of hemoglobin, maybe from a damaged blood sample or a high bilirubin, can sometimes interfere with the colorimetric methods used for chloride testing.
Good to know. But the basic tests themselves, they work the same for pets as for people.
Generally, yes. The principles of measuring chloride are the same.
Okay, so let's say a pet is diagnosed. High chloride, maybe high sodium, maybe acidosis. What does a treatment plan look like, generally?
The number one goal always is to treat the underlying cause, whatever is driving that electrolyte imbalance. But the specific approach depends on the situation. If you have hyperchloremia with hypernatremia, high chloride, and high sodium, the treatment often involves carefully giving hypotonic fluids.
Hypotonic,
Huh?
meaning less salty than blood.
Exactly, like 5% dextrose in water or half-strength saline. The key is giving it slowly, gradually, to bring the sodium down without causing other problems.
Right. And if the pet is just dehydrated?
If they're hypovolemic, meaning low blood volume or dehydrated, then isotonic fluids with a salt concentration similar to blood, like normal saline, are usually given first to restore their hydration and circulation.
Okay. And what about treating those specific underlying diseases like the diabetes insipidus or the acidosis?
Right. So for central diabetes insipidus, there's a synthetic hormone, DDAVP, that helps the kidneys conserve water. For the nephrogenic form, where the kidneys don't respond to the hormone, sometimes a diuretic like chlorothiazide can, weirdly enough, help reduce urine output.
A diuretic helps reduce urine.
Yeah, it's a bit paradoxical, but it can work in that specific context. And for the hyperchloremic metabolic acidosis, while fixing the root cause is primary, sometimes giving bicarbonate or potassium supplements might be needed if the imbalances are severe.
You've stressed correcting things slowly a couple of times.
Yeah.
Why is that so critical? What happens if you go too fast?
Going too fast, especially when lowering high sodium levels, can be really dangerous. It can cause fluid to shift too rapidly into cells, potentially leading to brain swelling, Or on the flip side, correcting acidosis too quickly or giving certain fluids can lead to complications like fluid overload in the lungs, pulmonary edema, or even drops in calcium levels, hypocalcemia.
Wow. Okay. So slow and steady is definitely the way.
Absolutely. That's why constant monitoring is key, checking electrolytes, body weight, hydration, urine output, the whole picture.
Got it. So thinking preventatively,
Hmm.
is there anything we as pet owners can do? What's the biggest thing?
Honestly, the simplest, but maybe the most vital thing, always make sure your pets have free access to fresh, clean water.
Simple as that.
Dehydration is such a common factor in concentrating electrolytes like chloride. So yeah, adequate water intake is fundamental prevention.
Basic, but crucial. Okay. Are there potential long-term complications we should be aware of if a pet has had hyperchloremia?
Well, again, it often comes back to the underlying disease or the effects of severe, prolonged high sodium. Neurological problems are a major concern, things like potential for blood clots in the brain, lingering seizures, or even persistent behavioral changes like hyperactivity.
That sounds serious. So, wrapping up, if someone listening gets this diagnosis for their pet, what's the general outlook? What can they expect?
It really truly depends heavily on the underlying cause. What's the reason for the high chloride? If it's something treatable, like dehydration that's corrected, or maybe mild kidney issues that can be managed, and it's caught early, the prognosis can be quite good.
That's hopeful.
But if the hyperchloremia is linked to a very severe acute illness or a chronic progressive disease, then, the prognosis might be more guarded. It's very individual.
This has been incredibly helpful. It's really striking how, like you said, interconnected everything is. One lab value, high chloride, can point to so many different potential issues.
It really does. It highlights how delicate that internal balance is, doesn't it? And how something as basic as water access plays such a massive role.
Absolutely. Thinking about how many different conditions can nudge chloride levels up or down, it really makes you wonder what other routine lab results might be hiding more complex stories about our pet's health than we first assume.
That's a great question, something to definitely keep in mind.
Definitely food for thought and a good reason to have those detailed chats with your vet.
Oh,
Thanks so much for breaking this down for us.
my pleasure.